There are 14 neurosystems that explain all of homosapien behavior. The Neuraconter system is the accounting of the central nervous system on down in those different behavioral economics heuristics that can be used for unifying finance and quality in every company, particularly healthcare and medicine, where it was created in a unification of quality and finance that we call leading expect. In the Jagphetic tradition, leading expect is the quality improvement methodology. Jagphetic is the ancient language of horse shepherds. Not everybody knows that the horse is actually American. The horse is from here. The horse is ours. Hunters poured into America from what was a land bridge into America, hunted the horse to extinction. And the relatives of that horse escaped out the Bering land bridge into Siberia and on down the steppes of Europe into the outstretched hands of the first knight, who said, "What did they do to you, girl?" And that's the origin of Hippocrates. That is the origin of superior in horses. That is the origin in medicine as we know it, where those that could be veterinary surgeons were perceived as better physicians than those that were, healers or caretakers of, Homo sapiens only. That's the tradition of the first knight. The Neuraconter is the accounting system that traces back to that first knight who reached out and said, "What did they do to you, girl?" To the horse that had been a part of a diaspora, that had escaped America, that had escaped out into Europe. And now we're in a new America where the horse has been reintroduced, and the Hippocratic Oath, the field of medicine, is larger than the field of horse trade, which is only in the last 100 years. That change has coincided with a doubling of Homo sapien life expectancy in only 100 years. Leading expect Jagphetic is the process through which we did that. It's the acronym SUSPECT, of which I elaborate on my book, Perfecting the Brand American Medicine. That can be used in every hospital, every physician group, every governor's office in America to increase life expectancy, to increase cures, to increase workability first medicine, to increase Epicurean first medicine, to increase cure first medicine. The Hippocratic Oath has not been prioritized, where we had 103 different shepherd traditions of what a good doctor was. We had 103 different traditions of Hippocrates. Those 103 traditions, after the Flexner Report of 1910, were concentrated down to two medical sects, and two medical sects only, that we know as medical doctor and osteopaths. We know that there were all of those other traditions that were not inferior. They were primary care providers of all of these different 14 medical specialties, of which the Neuraconter system is the center of it all. The behavioral economics of Homo sapien behavior can be summarized in not four qualitative kinds of physician specialties, but 14. Physicians inherently know that because we've added residency and fellowship after medical school. Physicians intuitively know that we need a third or more medical sect. We know that the third or more medical sect shouldn't have been nurse practitioners or physician assistants. It should have been a higher, medical doctor, medical science trained in the first knight tradition. And that's what we're trying to do, is unify the Neuraconter system in your practice to build that new primary care base underneath you, so that a surgeon is not seeing non-surgical cases. So a general surgeon isn't seeing non-surgical cases. So a neurosurgeon isn't seeing non-surgical cases. So an orthopedist isn't seeing non-surgical cases. So a gastroenterologist isn't seeing non-procedural cases. So a dermatologist isn't seeing non-procedural cases. So that we advance medicine to add a third or more medical sect of which, here at Profi.me we've launched 6 chivalric orders that are based on those 103 shepherd traditions of healing that are entirely predicated on medical science, that are Epicurean first, workability first, life expectancy first, ability first, cure first, and Jagphetic, which is a first night first. And our Neuraconter system is the unification of quality and finance in your practice to help improve patient compliance, for example, so that your surgeons are able to see surgical cases. It's building that primary care base, that public care base upstream, so physicians working at the top of their license all day long and not taking confession. Because there are surgeons in America, all over America, that are taking confession from their patients rather than taking surgical order forms. And we want to help be a part of that new tradition of having surgeons do surgery and have primary care docs do primary care. We know that there was a third or more medical sect before, and we want you to join us in having surgeons working at the top of their license and building that network underneath them with the existing credentials that are out there in the marketplace today. Join us at Leading Expect Jagphetic, the unification of quality and finance, the Neuraconter system, the accounting system that unifies the top of the surgical specialty with finance. You can measure in hours and dollars the activity in medicine and unify it in a way that's better for physicians than what we've done. Join us at Profi.me.